Hello viewers, welcome to our channel Mine. One of the common queries which I get from my pregnant patients are, Doctor, can I travel during pregnancy? So come viewers, we will discuss about it. Which is the best time to travel during pregnancy? Hands down, it is the second trimester which is the best time to travel during pregnancy. During first trimester, patient suffers from nausea, vomiting, tiredness, and we don't want travel to compound that problem. And the risk of miscarriage is also quite high in the first trimester. So it is better to refrain from traveling in the first trimester if you can manage to do so. And in third trimester, the patient feels heavily pregnant. She can't sit for long hours, and that can cause back pain, and they can have swelling of the legs. The risk of gestational diabetes and uncontrolled blood pressure is also quite high in the later part of pregnancy. And also the patient is at the risk of preterm delivery and early deliveries and all that. So third trimester also not a good time to travel during pregnancy. During second trimester, patient feels light. The nausea vomiting of the first trimester has come down and she doesn't feel very heavily pregnant. There is no swelling of the legs and all that. So usually second trimester is a better time to travel during pregnancy. Which mode of travel is safe during pregnancy? Usually all modes of travel are safe during pregnancy, and the choice of the mode of travel usually depends upon the distance which you wish to travel. What are the precautions you have to take during traveling in the car during pregnancy? First thing is, always wear a seat belt, and there's a correct way to wear the seat belt around the baby bump like this. Second thing is, when you are having a long distance travel in the car, make sure you get down, you stop the car, you get down every 2 hours and then walk a bit, because pregnancy, we call it as hypercoagulable stage. That is, there is increased tendency for the blood to clot during pregnancy. So when you are immobilized for a long period of time, there is always a possibility that the blood can clot in the legs. That's why it is very important to stop the car every 2 hours or 3 hours or so and walk a little bit and then again restart the journey. Alternately, you can even wriggle your toes and legs in the car only to keep your leg mobilized. Third thing which you have to take care is, when you are traveling, always try to pack your own food and water if it is practical, because if you pick up any infections while traveling, there are not many medicines which we can give during pregnancy. Fourth important thing to take care during car travel is, always push your seat little back, because in an unexpected event of any accidents or anything like that, the airbag should not impact the baby bump. Is air travel safe during pregnancy? Yes, air travel is safe during pregnancy, but again, conditions apply. First thing is about the timing of pregnancy. If you are carrying a singleton baby, before 36 weeks should be safe for you to travel via aeroplane. But if you are carrying a twin pregnancy, before 32 weeks will be safe for you to travel via aeroplane, because beyond this time the chance of delivery is high, and neither the airlines person nor you would want to deliver your baby on the aeroplane, isn't it? Second thing is, whenever you are traveling in aeroplane, always book a aisle seat so that it is easy for you to get out and walk around. As I told before, pregnancy is a hypercoagulable state. So when you are sitting for long hours with your legs being immobilized, there is a chance of blood clotting in your leg. That's why it's always important for you to get up and walk every 2 hours. So book an aisle seat and keep yourself hydrated. When you're traveling in plane, always wear a non-restrictive clothing, and if it is practical, try packing your own food and water such that you should not come down with any infections. The noise and the vibration which happens in the aeroplane usually doesn't affect the pregnancy. There are some cosmic radiations at the high altitude. So these cosmic radiations, when they reach the ground, they are of very negligible amount, but at high altitudes they are of significant amount. But for infrequent travelers, the amount of cosmic radiation will not cause any harm to the baby. But for professional travelers, it might cause a little bit of harm and they might have to reconsider it. So, who should not travel during pregnancy? People who are having twin pregnancies, especially after 32 weeks period of gestation, should not travel because they are at the risk of preterm delivery. People who are having low placenta previa should not travel during pregnancy because they are at the risk of having bleeding during pregnancy. People who are having infections, because already they are at risk of preterm labor and we don't want travel compounding the problem. People who are having uncontrolled blood pressure should avoid traveling during pregnancy. Friends, these are all general guidelines. For individualized suggestion of whether you can travel during pregnancy or not, you should consult your doctor because they will see your situation and give you an individualized suggestion. Always make it a point to talk to your doctor before planning travel in pregnancy.